Beautiful but warm. In fact, it's just plain hot Monday. This is Dan Vaughn along with Joy Robertson and Andrea Lord. And we have our special guest this morning, Senator Roy Blunt. Good morning, sir. How are you?
Hey, Dan, good to be with you. I'm a little concerned here. You brought in the first team, though.
The first team, and
I'm surrendering. I'm just giving up right now.
Roy's got his white flag in here.
Right. Whatever the three of you all think, maybe is what we ought to do.
I think there's something you're not going to give up on, though, and this is last week's Supreme Court ruling regarding Affordable Health Care Act.
Right.
Where were you when you heard the news? What was your reaction?
You know, I think I was actually at my desk as almost everybody else was. That was one of those moments that everybody knew it was coming, and everybody was waiting to see exactly what the court said. And you all remember, it's sort of interesting, both a couple of I think Fox and CNN both initially got it wrong because they're leafing through the decision as quickly as they can, and the decision says can't do this under the Commerce Clause.
Under the Commerce Clause, which is what actually tripped a lot of people up.
And that's actually a pretty good thing to have on the record, that you can't just do anything you want to under the Commerce Clause, but then you get a few pages over and you find that even though the administration had said repeatedly until they got to court, this isn't a tax, they said in court it was a tax, and that was good enough for 5 of the justices to decide it's a tax. And I think even Justice Roberts said it's not the court's job to protect the American people from bad ideas that their elected officials pursue, but to decide whether you can legally do it or not. And you can do lots of bad things that are constitutional. So I'd been saying for months there are really 3 questions here that needed to be answered. And if the answer to any of them was no, we shouldn't do this. And the 3 questions were, is it constitutional? Is it a good idea, and can we afford it? Is it constitutional? Is it a good idea, and can we afford it? I think the American people, as they've looked at it, certainly Missourians have decided not a good idea, and we can't afford it. So now people get to answer the other 2. The court narrowly answered 1, but they did answer 1. Now what about the other 2? And people still have a chance to weigh in on the other 2 and say, no, we don't want to go in that direction.
Does the Senate at some point now, does it come down to just the Senate just needing a simple majority if they wanted to overturn this because of now the fact that it's a tax and not necessarily a budgetary?
Well, not necessarily a policy. That's really the question that at some point the Senate parliamentarian would ask. If there are 51 senators who say we just don't want to do this, then the parliamentarian decides whether it's a tax, and 51 can say over the next 10 years, the so-called budget window, we don't want to do this. And then the parliamentarian gets to decide. But I think the Supreme Court decision makes it much more likely that the parliamentarian would have a hard time saying, no, the parliamentarian basically would have to say, well, it's not a tax. Well, the Supreme Court just said it was a tax. Right. And so if there are 51 people in the Senate, and you would assume that would need to be 51 Republicans, which means there need to be 4 more Republican senators, or 3 Republican senators and a vice president. And we're really at that close to probably how we go down the road on health care. And I see this as a bad idea, a government takeover of health care. People will not like it if it happens, and it will cost so much more than anybody has ever estimated. Hopefully we don't do this, and so we'll see. But 51 senators, I think now, could not take it actually off the books. It would still take 60 to do what the court almost did. 4 of them said, let's eliminate every line of this, which was, I thought, that was the most any opponent of the bill could possibly have hoped for. You got within 1 vote of every single line of this going off the books. And then you come back and say, okay, in 2,600 pages, was there a good idea there? And if there was, let's get a 20-page bill that people understand and put that idea back on the books. Right. And if there are 2 good ideas, let's get 2 20-page bills and put those back on the books. But the court almost eliminated it all. But 51 senators, in all likelihood now, could say, no, we're not going to fund the implementation and we're not going to collect the penalties. And in the meantime, here's what we would like to do. Let's do medical liability reform. Let's let people buy policies across state lines. Let's do things that would make the current system work better rather than this bill, which I think everybody that really has sat down and looked at it understands you'll have more people uninsured if this bill goes into effect, not fewer people.
And
uninsured.
I think there's a good likelihood, depending on re-election status, is you could get 4 Democrats to actually.
Well, maybe you got a lot of Democrats running next time, just like you have a lot more Democrats than Republicans running this time. 2006, the year that we're coming to the 6-year end of, was a really good year for Democrats. And so a bunch of them are running for re-election for the first time. And 2008 was a really good year for Democrats, and you have a lot more Democrats that will be running than Republicans. But they've all voted for this once, so I think it's pretty hard for them to vote to undo it. In all likelihood, if this happens, and maybe you're right, Andrew, maybe if you get 51 Republicans who are willing to do it, suddenly then 2 or 3 Democrats say, hey, it's going to happen anyway. Why do I want to go home and explain why I was for this bill this law that people don't like? But I don't think, I would not bet, having watched Congress for a long time, I wouldn't bet that Democrats would be part of the first 51. But they might be part of the difference in 51 and 54 or 55 if it's already happened anyway, because people don't want to explain this. And in fact, you could see Democrats last week in states that you could, like ours, who just simply didn't want to talk about. They were not talking about what the court decided because they don't want to have any more to do with this than they absolutely have to. But remember, they have all voted for it. Every Democrat running for re-election to the Senate voted for this bill.
And we've got to remember what Nancy Pelosi said. Let's pass it, and then we'll see what it's in it. Hey, Senator, how will this affect Missouri? Last summer, Missouri voters approved a referendum, I think it's by 71 to 29%, rejecting the law's individual mandate requiring patients to purchase insurance or face penalties. And also, there are about 14% of Missourians that do not have insurance. How will this affect Missouri? It's this one state.
Well, we were the first state where people actually had a chance to vote on this, and as you said, begin to show almost what the national numbers are now. Missourians were a little ahead of the pack on this because at that day the national numbers were not 71 to 29. It was unpopular, but not overwhelmingly unpopular. Right now, the national numbers, if you look at the polling, about 2 out of 3 people do not want this bill to go into effect. And the more they look at it, the more they hear about it, the more they're going to understand why they don't want to do it. Now, let's talk about the big decision that will face Missouri. And I don't give a lot of advice to Jefferson City. When I went to Washington a few years ago, I decided until we solved all the federal problems, I wasn't going to try to be the expert on what people ought to be doing in Jefferson City. And we still seem to be quite a distance from solving all the Washington, D.C. problems. But the big decision they'll have to make, and in every state now, the court said that the federal government with this law cannot force the states to add 25 million more people to Medicaid. And my guess is most states will not add these people. Medicaid's already making education a second-rate priority in state after state. It's 24% of the average state budget today. It'll be 29% next year, and that's before the health care bill goes into effect. So of the 40 million people they were hoping to add to insurance, the people that voted for this bill, the court said 25 million of them don't have to be added by the states, and I really can't imagine that states will do this, that will add these people, because it's just Medicaid is killing higher education, elementary and secondary education. It's hard for me to imagine that state governments will now take the further step and say, oh, by the way, we're going to insure another 25 million people that cost the state
what
money.
State can afford that at this point?
I can't imagine any state. Now, California may do it, but they're not appear not to be bound by what you can afford. It's hard to imagine that it'll happen in Jefferson City. And then you take the federal government saying exactly what kind of insurance you have to have before you qualify to have, quote, insurance, unquote. You're going to wind up with people paying the penalty instead of getting the insurance. And then if you can get insurance once you're sick, as long as the penalty is less than the insurance, why would you get insurance?
How can Mitt Romney overcome the fact that in Massachusetts there is a very similar health care plan in place? What can the Republicans bring to the table that will give the American people the idea that there's some kind of health care reform out on the horizon somewhere?
Right. I don't know how similar it was. It was similar. I don't know if it had all of these boards like that will decide what level of care is appropriate and all that sort of thing. But even whether it did or not, I think a state deciding to do that, that's why we have 50 states, is one thing. And Governor Romney has said, and I believe he is absolutely committed to do what he has said, which is he'll do everything possible to repeal this starting day one. So, you can the choice is not what either of these men did in the past. The choice is, do you believe what they both say they'll do in the future?
Well, Mitt Romney was, and I saw a soundbite on this yesterday, he said the individual mandate in his home state of Massachusetts was critical because people have to play a role in their own health care. They have to divvy up money for themselves. And I think maybe that's central to the health care reform here. Would you agree that something has to be done to encourage more people to get into the system and pay for their own health care? Because if they don't, then the rest of us end up paying it through higher premiums because hospitals aren't going to turn people away.
But Joy, if you have this as a tax, this is clearly the biggest middle-class tax cut anybody has ever, tax increase anybody's ever passed. I saw some numbers on this Friday, and the people that is estimated will pay the penalty, 76% of them are families of four that make less than $72,000, between $24,000 and $72,000. So surely that's not the answer, that you're going to penalize families that can't afford to get insurance. I think there are ways to have a marketplace that works much better. Buying across state lines, finding a policy that you can afford that provides you the protection you need. Maybe you're a family that can't afford first dollar coverage, but that's not what you really worry about. What you really worry about is losing your house, losing the farm, losing your little business. And what you need is a policy that if you have more than $10,000 worth of medical bills, but this law wouldn't allow you to buy that policy and that policy to count. I worked hard to get something called health savings accounts, which you could qualify for but only if you had a high deductible policy. Well, this bill wouldn't allow you to have a high deductible. And by the way, high deductible was anything over $1,500. So, you could see a family making that decision. Okay, let's assume that this insurance is so much less if you don't pay the first $1,500 that we can afford it. And if we have a health incident, we can afford to pay that $1,500, but we can also buy insurance. You're just going to wind up with more. So a marketplace that works is better. Buying across state lines, small business plans where little businesses can find businesses like theirs, like we've done in actually Southwest Missouri Manufacturers Association has had a plan for years where they have dozens of businesses that all go to them and they become a very big plan. So there's a lot of things to do. The false choice here is we have to have health care that's not working as well as we'd like it to today, or the only other option was the president's plan. That's the false choice. There are things that need to be done. I just don't think this law does them, and most Americans and most Missourians agree with me on this.
Are there health care reforms or are there things that you agree with in the current health care reform bill? I mean, like the staying on the parents' insurance coverage to 26, things like that. Are there things that you do agree with? Is there any part of it you do like?
Well, that was actually my bill. That was my bill in the House. The president incorporated it into his plan. I was the only person that introduced that legislation. Now, there are some conservatives that think, well, no, that's still not the role of the federal government to make that decision. The federal government has a law, or had a law that said you couldn't stay on until 22. By going to 26, you take 3 million people off the rolls of the uninsured and put them on the rolls of the insured for not very much money, because they're 3 million pretty healthy people. The reason they don't get insurance when they get out on their own is they really think, hey, I can take a chance here. I probably don't need this. And they're normally right. Unless they have an accident or get some unusual early onset of a disease, they're normally right. So, yeah, I'd be for that. But we could pass that bill separately or not. If we could ever get this down to where we were debating whether the federal government or the state government should do that, we'd be in a much better place than we are now. Not letting people go, having rules so that people, if they have insurance, that there can't be something in the fine print that says, once you get to $150,000, this policy no longer covers you. I think you could do that. The pre-existing condition is a different argument, I think, than that. Pre-existing condition for kids. Some kids born with a pre-existing condition, they ought to be able to get access to insurance. Well, some adult decides for whatever reason they don't want to have insurance until they get sick. You can't let that be the rule, or insurance just won't work. If you can insure your house once it gets on fire, if you can call the insurance company and say, by the way, my house is on fire, I want to be covered right now. Obviously, fire insurance would cost a lot. So we have to make this system work better, and there aren't many things in this law that does that. Of the 2,600 pages, could you figure out how to save 100 of them? Maybe. But it's easier to go back, I think, and say, okay, let's reinstate these 2 or 3 small ideas out of this one really bad, big idea.
Of course, some of these provisions you're talking about are already in effect in 2013. The so-called up to insurance age 26, that is in effect this year.
Right.
And also the insurers can't deny coverage to children with health problems. That's also in effect, I understand.
I think that's right. And, in our state, for instance, Blue Cross Blue Shield for years has had that policy, which not very many people know about. It's a state-by-state decision. But in our state for years, if you wanted to go to Blue Cross with a child that had a pre-existing condition, they will cover that child. So that's not new in Missouri. In Missouri, you could stay on your parents' health care until you were 25. So we've added 1 year in our state. But those are in effect now, and they're still in effect. And if the law is totally repealed, insurance companies, one, could do those things on their own if they wanted to, but two, I think things like that just make common sense to people would and could be reinstated. Access to health care if you have a pre-existing condition. Let's make these state risk pools work better.
Missouri does have a high-risk pool.
They do. And I should have said high-risk pools because that's what they're called. Let's make these state high. The 35 states have them, but 50 states could have, and let's make them work better to convince people that you can get insurance after you get sick is going to send the insurance rates sky high. And for most people, they'd say, let's look at it this way. You say, okay, the penalty's $200. My insurance costs a year. Insurance might cost me $200 a month. I think I'll just pay $200 a year till I get sick. And if I happen to get sick, then I'll call and say I want my insurance now at $200 a month as opposed to paying the penalty of $200 a year. But remember, that penalty will be paid by people who are working hard to get into and stay in the middle class. This is the biggest middle class tax increase in the history of the country, and almost nobody in the so-called upper class pays this penalty because they have insurance.
What about that? In 2018, I believe there's going to be an introduction of a tax on the so-called Cadillac plans, or those that have a premium insurance plan that's employer, I guess, funded or partially funded. Does that affect any members of Congress with plans that you all are able to buy into? And then how do you see that affecting some of those employees? Do you think that they would drop those insurance plans and end up just going ahead and paying the penalty?
Again, it's the federal government decided, okay, if you don't have a tax, if you don't have a insurance plan, we're going to make you pay a tax because we know better than you do whether you need one. And if you have too good a plan, we're going to make you pay a tax. Do we really want to go down that path? Where at both ends of the spectrum, the federal government says, if you're not exactly in the frame we think you need to be in health insurance, you're going to be penalized. If you decide you can't afford anything but a $5,000 high deductible policy, and you buy that policy, you're still going to be penalized because you don't have the plan that the board says is what the plan should look like. Or if you have too good a plan, we're going to penalize you for that as well. I just think this is not where people want to go, and my belief is it is not where we'll go. I think the Supreme Court, rather than answer this question, has reignited now the real debate, which is, okay, now that you've had time to see what's in the bill, do you want to do it or not? And there's one way to decide whether you want to do it or not, and that's to decide who you're going to hire to do these jobs.
It's up to the states to put these exchanges in place by January 1st of 2013, to create these exchanges. If the states don't do that, the federal government will do that for them. What about Missouri? Should Missouri get on the stick here and get these exchanges in place, or is it something that this state should roll the dice on and let the feds come in and take over?
Well, there was back to my earlier comment on this topic, there was a letter being circulated this week, and I was tempted for a minute to sign it, which was just encourage the states not to do this, but only for a minute. And I thought, that's really not my job. That's a job that people in Jefferson City have to decide. So why do I want to make it harder for them to make that decision by trying to act like my job is so well done that I can do their job for them? States are going to have to decide. And I do think that most states, not trying to say what our states should do, I do think most states will not decide to add the people that really get added to Medicaid. I don't know what states will do about the exchanges, nor do I know. We've only got a few weeks here, a dozen weeks or whatever it would be,
absolutely,
until people kind of know what the likelihood of whether they have to make that choice is or not. If Mitt Romney gets elected president, if Republicans take over the Senate, I think Republicans on any circumstance keep control of the House, then we're probably not going to have to make that choice because we're going to try to find better and different solutions than the solution in the president's health care bill.
But, as it stands now, as I mentioned before, I think there are 154,000 people in Missouri that are uninsured. Most of them will go on Medicaid, a big part of them. In fact, our Medicaid policies, costs will go up 30%. Now, a lot of this will come from the federal government, but a lot of it comes from Missouri. And we're on a tight budget anyway in Missouri. And if you get 30%, if it goes up 30%, that's I don't think everybody's scratching their head and say, where are we going to get it?
Well, let me give an example. In Tennessee last year, Medicaid increased 15%. Coincidentally, it's the exact percentage, but it's the reason that higher education went down 15%, the amount of money that the states went to higher education. Elementary and secondary went down. Everything else the state did goes down. So that's going to be a big decision for states if this law stands as the Supreme Court has now said it's written. And if states don't do it, almost everybody that you could argue was going to get insurance won't get insurance under this. And employers are not going to provide. I can't tell you how many, particularly franchise restaurants that work on a pretty slim margin. They say, look, we're just not going to have very many employees at 20 hours anymore. And my buddy across the street who has the other franchise restaurant, the other fast food restaurant, may hire that person in the afternoon, but I'm not going to have a 20-hour employee, and he or she's not going to have a 20-hour employee. So policies that they've had where you maybe had a fair, in the case of most of those policies, I think you paid a little at the front as the person who had insurance. Your insurance pays in the middle, but then there's a pretty low cap. Like maybe you only have $5,000 or $6,000 of health care insurance, but you had it, and it didn't cost you much of anything, but that would go away. So you will have more people uninsured under this plan if we go forward than you had when we had the debate or than we have today. This will produce bad results. Nobody in the Senate, I wasn't in the Senate yet when this was passed, but nobody in the Senate who voted for this bill thought it would be the final bill. They had 60 senators. They passed a bill. They thought we'd go to conference committee and with the House and write a real bill and come back, and the 60 of us will vote for that. But then that 60th senator went away when Scott Brown got elected in Massachusetts. So suddenly this, what I think is a pretty ill-conceived Senate bill, in 2009 becomes the only option, and it's the option that the president and Nancy Pelosi and Harry Reid decided, okay, this is not perfect, but it's the one thing we can get, so let's get it. And then I don't know if they thought they'd change it later or what, but it will produce bad results for many, many people and not very many good results for anybody, particularly with the court decision that says these 25 million people that were going to be insured. And by the way, those people under the law don't qualify for the exchanges. If you meet that criteria under the law.
Which criteria?
Largely it's single adults that meet the Medicaid criteria. Under the law, it says they can't buy insurance in the exchange.
What about people who can't afford insurance is the big question, and they have nowhere to go to get it now other than a very pricey personal plan that they can get an individual plan. Would you say that they could go to an exchange and maybe find an affordable plan under one of the different offerings through a state exchange, though?
I don't have
Is it an option?
I don't have a problem with the concept of the state coming up with an exchange. It's sort of like I don't have a problem with small businesses being able to band together and get their insurance as a larger group. Mm-hmm. I don't have a problem with the states coming up with an exchange that individuals could get into as a group, though most of those companies will not want an individual who's already sick. So that person would still have to go and could go today to the high-risk pool.
Mm-hmm. Okay, I want to thank you very much, Senator Roy Blunt, for coming in this morning and visiting with us here on this, I guess it's on everybody's mind, the so-called ObamaCare bill or Affordable Care bill or whatever it might be. Thank you, sir, very much for being in this morning.
Well, it's good to be with you, and this is going to be a big topic for a long time. But the biggest topic, I think, is still going to be jobs in the economy, and how this relates to jobs in the economy will be an important part of that ongoing discussion as well. So we're going to be talking about that, and people now get to make an important choice about whether they want European-style health care or whether they want to make a competitive marketplace work better and create more alternatives for people, not fewer alternatives.
And, Senator, anytime you're in town, we are invited to be on line whenever you can. Got to take a quick break. We'll be right back. Stay tuned, everyone.